Hi, I'm Dr. Ramsey, and I wanted to answer a question that someone asked in one of our videos. And the question was specifically about thyroid replacement in women that have PCOS, right? So, PCOS is polycystic ovarian syndrome. This is not something that gynecologists treat. It should be something that endocrinologists treat because it has more to do with insulin receptors than it does on our ovaries and cysts in our ovaries. It has everything to do with insulin and how well it works on our insulin receptors, which means it's going to dictate how well, whether or not we develop diabetes, whether or not we develop breast cancer, whether or not we develop Alzheimer's, like they're all related to each other. And PCOS women, there's a lot of them. 50% of us are PCOS women. Don't even know it because you can be thin and have PCOS. You can be heavy. You can be infertile. You can be fertile. You can have cysts on your ovaries or not. That's what makes this endocrinopathy a little bit tricky. What I love about PCOS women is my teacher said that every woman has it until proven otherwise. And when we look at women this way, we're not going to miss it. And the reason we don't want to miss it is we want to prevent those conditions I talked about. PCOS women do not make progesterone. PCOS women need more thyroid, and that's what the question's about, than other women because their metabolism is compromised. Even if they're thin, their insulin receptors aren't working that well. And so we want to give thyroid, and one of the main reasons that I want to give thyroid to all women that have PCOS is because of one protein that goes up with it, right? So there's a metabolic protein called sex hormone binding globulin. We measure this on every female and every male. When this level is low, our metabolism is slow. Again, we could be thin or heavy with this SHBG and PCOS women. When we give thyroid, we raise this metabolic hormone. So we're improving their metabolism. We're improving all of their outcomes. We're reducing their risks of weight gain, fatigue, again, like those three, which are going to be breast cancer, Alzheimer's, heart disease, diabetes. So those four are related to PCOS. If we treat them when they're young, we prevent a lot of the, excuse me, age-related illnesses that come with it. So thyroid is one of the big ones for PCOS women, mainly because of that metabolic protein and also because their cells are slow. Turnover is very slow. And we know if we're giving too much thyroid because women are going to have shaky hands, racing heart. That's too much thyroid. We back off always. We don't ever want to have side effects, but we definitely want to get the metabolic benefits in PCOS women that they need. I hope that answers your question. Ask any more questions that you have. I love answering and helping people understand the endocrine system. So if you have any other questions, please don't hesitate to ask. Thank you so much for asking. And I'll see you again sometime. Bye-bye.